knock. Come in. Hand hygiene. Hey, my name is Caitlin, and I'll be taking care of you today. Can you tell me your name and date of birth?
Franklin Henry, 2/22/94.
All right. Do you have any allergies that I should know about?
No.
Okay. Well, the doctor has ordered for some Humulin R, which is regular insulin, due to a recent high blood glucose level. And some possible side effects to this medication are lightheadedness or a really low blood glucose. So if you feel like you're experiencing either of those, please let me know, okay? All right, at this time I will prepare the medication. So I'm going to put on gloves. Okay, and so at this time I'm going to do verify my 6 rights of med administration. So I have the right patient, the right medication, which is Humulin R, the right dose, the right route, which is IV, the right time, and the right documentation. Okay, so to get started, I will remove an alcohol swab and clean the vial of insulin. Okay, and I will, the order was for 15 units of insulin, which is equivalent to 0.15 milliliters on this syringe. So I'm gonna pull back to 0.15 mLs. I'm gonna remove my blunt tip cap, insert it in the vial, insert the air, flip it over, pull back to 0.15 milliliters of insulin, okay? And then using a swoop and scoop method, I will recap my insulin needle. And at this time, I will get ready to flush the flush the IV site. So I will take an alcohol swab and I will clean the hub for roughly 15 seconds. Okay. And before I get started with that, I will verify that the normal saline is compatible with the insulin that is being given, and there's no reason to dilute insulin at any point. So I will take the cap off of my flush and attach to my saline lock. And to check for patency of the saline lock, I will aspirate, and I will see that there's blood return. But before I do that, I will unclamp my IV. I will aspirate, see that there is blood return, and then I will flush the IV with 5 cc's or milliliters of normal saline. Okay, I will remove that. Now I will remove the blunt tip off of my insulin. I will attach it, and I will administer the 0.15 milliliters over a total of 1 minute. Okay, it's been a minute, so I'll remove it, and then I will flush it again with another 5 cc's of normal saline. Okay, then I will remove that, and at this time I will clamp the IV again. Okay, and that completes the administration of the medication. And then 15 to 20 minutes later, I will come back and I will evaluate the blood sugar again of the patient. And for it to be therapeutic, the blood sugar would be lowered and within range without being too low and putting the patient at risk for hypoglycemia.